Koya Hartfield is the strong, silent type. At 11 years old, these are just a few of the health conditions she's overcome.
I've, never seen someone as sick as her come out as good as she did.
At just 15 months, Koya needed a liver transplant.
Gave her a piece of my liver.
It worked fine for about 10 years. Then her body started rejecting it. Koya developed cirrhosis. Alcoholic cirrhosis is the fourth most common cause of death in adults between 45 and 54 years old. But Koya's condition was caused by a bile duct disease she was born with. As she waited for a second liver transplant, her kidneys failed. She developed encephalopathy and almost went into a coma. Her dad felt helpless.
She would ask me on a regular basis, am I going to die?
Valerie Broughton's mom knows what it's like to hear that question.
Just thought, could it be possible? She was just 15.
A small spot changed everything for this competitive dancer.
I thought I had the mole my whole life.
Wasn't scary, wasn't black, wasn't irregular, and wasn't very large.
It wasn't here in her 6th grade picture, but you can see it on her collarbone in her freshman photo. Then her friends brought it up.
So that gave me a suspicion that the mole was growing larger.
A week after it was removed, she learned she had stage 2 malignant melanoma.
It's very surreal. You never imagine it happening to you.
Doctors at Nationwide Children's Hospital say the average age of diagnosis for the deadly skin condition is 60. But they're seeing an increase in melanoma in kids ages 5 to 16. And it's responsible for 1 out of every 10 cancers in teens.
I remember I'd had a bad sunburn, I think the spring break before, and I was kind of wondering if that had possibly contributed.
Experts say along with sun exposure, tanning beds could be big contributors to the melanoma increase in children. California just became the first state to ban kids under 18 from using them. And a new study shows invasive melanoma may be more common in kids than adults with the disease. Val had cancer removed from her collarbone.
Then I was cancer-free.
From cancer to high cholesterol, more and more kids are living with adult diseases. In fact, 1 in 5 kids in the U.S. have high cholesterol. And get this, up to half of all new diabetes cases in American children is type 2, or what used to be called adult-onset diabetes. The CDC estimates children born in 2000 have a 1 in 3 chance of developing diabetes. For Hispanic children, the projected risk is 1 in 2. And gum disease isn't just for grandparents. It's estimated 50% of kids have periodontal problems. Girls have a higher risk of developing it than boys because of increases in female sex hormones during puberty. While a lot of adult conditions in kids are preventable, Koya's were not. She's still on a feeding tube, but a donated liver saved her life again.
They gave a sweet and wonderful person, a second chance.
Against the odds, it seems she's beating the grown-up problems that have plagued her childhood.
She will have a good life. Yeah.
I'm Vanessa Welch reporting.